Hi, this is Chahalpreet Kaur from Bow Valley Campus Medical Center. In this video, I will gonna show you how to record a patient chart. So for that, we need some supplies. First, we have a file folder. The color of the file folder correspond to the first letter of the patient's surname, and then we have the name stickers, which correspond to the first three letters of the patient's last name, and then we have a year sticker, and then we have a prong fastener to hold the content of the file folder, and then we need a sharpie and a pen, and we have a hole puncher, and then if we have two or more than two patients with the same name, then we will gonna have a name alert sticker on our file folder, which give a clue to a person that there are two or more than a patient with the same name in our database. So for finding a correct patient chart, just check the date of birth and the PHN from the content of the file. And for the content of file, we have a registration form, and then we have a patient history questionnaire, and then we have a medication list, and then we have a progress note. So to start with, I will gonna take the registration form as my reference to create a patient record chart. So my patient name is the Chahalpreet Kaur and the last name is the Kaur. So I will gonna paste the name label as the file folder giving us the guidelines to start from here. So I will gonna paste the first letter of the last name of the patient, which is Kaur, K, like this. Make sure when you are pasting the sticker, it should be centered and aligned, and then A, and then U. These are the color coded, which helps us to make the filing easier and to prevent the misfiling. So in this way, I paste the first three letters of the last name of the patient in this way at the top, and then at the bottom I will gonna put the year in which we are creating the patient record chart, and in between these we will gonna write the name of the patient starting with the last name and the first name. So I paste the year label at the bottom. The year label helps us a lot in the future. Like it helps, like it reminds us when the patient chart has been created, and also it helps us to know how long the file has been in the office. Like whenever we need any patient, if he or she comes after 3 or 4 years, then we will just we'll just have a clue that in which year we have a patient. We have to make the patient file chart, and so in this way the year label helps us a lot for the future references. And in between we will gonna write the last name and the first name of the patient, and while writing, make sure that it should be in the capital letter and it should be legible, and we will gonna write it from the left to the right on the presumption that anybody who is reading the name, that he or she will be reading from the left to the right. So in this way I have created my file folder. The last three name, the name in between the year and the last three letters of the patient chart. So from behind it's also looked like the same. And now, in case if we have a two or more patient with the same name in our database, then we will gonna paste our name alert sticker on our file folder like this. Like this. And now, to put the contents of the file folder, every institution have the different policies, like how to put the papers in the on the left side and the right side. So according to the Bow Valley Campus Medical Center, we will gonna put the registration form and the health history questionnaire and the medication list on the left side of the file folder, and the progress note we will gonna put it in the right side of the file folder. To insert all of these document, we will gonna make a hole with the hole puncher. I already made the holes, and then we will gonna insert the prong fasteners. And then the registration form, health history questionnaire, and the medication list we will gonna attach here. And then we will gonna close it like this, and then here and then the progress note here. We're gonna write all the demographic information, all the blank progress note, health history questionnaire, and the medication list. In this way, we are making we are making the patient health record chart like this way. So I'm done with my patient health record chart. Thank you.